You know that feeling? Your heart just sinks when you see it. Your cat is in the litter box, hunched over, straining, maybe even crying out a little bit, but nothing's happening. It's so worrying and your mind just starts racing with questions.
And you know what? You're right to be concerned. Straining can point to a few different things, but today we're going to focus on one of the most common reasons, constipation. In the next few minutes, we're going to walk through what's happening inside your cat's body, the clues to look for, and, most importantly, how we can get them feeling better.
So, when you see your cat straining like that, what's actually happening? Well, it all comes down to the pretty simple, but definitely uncomfortable, mechanics of constipation. To put it simply, it's just when it's really infrequent or difficult for them to pass stool. Think of it like a traffic jam in their digestive tract. Everything gets backed up in the colon, and it just has nowhere to go. See, the colon's main job is to act like a sponge, absorbing water to keep the body hydrated. But if a cat gets dehydrated, maybe from something like kidney disease, or honestly just from not drinking enough water, their body goes into conservation mode. It tries to pull every single last drop of water out of the stool, and that's the real root of the problem. It leaves the feces hard, dry, and just incredibly difficult to pass. And this is exactly why we've got to take it seriously. It can be a bit of a slippery slope. What starts as just mild constipation can easily become chronic. From there, it can progress to something called obstipation, which is a really severe and painful blockage. And if that goes on too long, all that stretching can permanently damage the colon's muscles, leading to a very serious condition called megacolon. That's when the colon gets so enlarged and weak that it literally can't push feces out on its own anymore.
Okay, so let's dig into this a little more, because constipation isn't really a disease itself. It's a clinical sign. So to treat it right, we have to put on our detective hats and figure out the underlying reason it's happening in the first place.
And what's really interesting, or frustrating for us vets, is that in a majority of chronic cases, over 60%, the cause is diagnosed as idiopathic megacolon. That's a fancy way of saying the colon has enlarged and weakened for, well, a reason we just don't know. The next most common cause, at around 23%, is a narrowing of the pelvis, maybe from an old injury, which makes it physically tough to pass stool. All those other causes we think of first, like dehydration or pain from arthritis or stress, they actually make up a smaller slice of the pie in these chronic cases. Now, your cat can't use words to tell you what's wrong, but trust me, they are sending out all kinds of signals. You might see them going in and out of the litter box over and over and over again. And when they finally do manage to pass something, it might just look like tiny, hard little rocks. Because they feel so full and uncomfortable, they might stop eating, maybe they start vomiting, or just seem really tired and want to be left alone.
Seeing those signs means it's time for a vet visit. And I get it, that can be super stressful. But figuring out what's really going on is a pretty straightforward process. And you, the owner, are a huge part of it.
First things first, we're just going to talk. Everything you've seen at home is incredibly valuable information for me. Then, a gentle physical exam lets us actually feel the colon. A lot of the time, we can feel that hard, impacted stool. X-rays are fantastic because they show us exactly how severe the blockage is and can even reveal things we couldn't see, like an old pelvic injury. And finally, some simple blood work helps us check for any underlying culprits like dehydration or kidney disease. So once we have a diagnosis, we can move on to the best part, making your cat feel better. The path to relief is all about two things: immediate help and smart long-term management. Okay, first step. Always, before we do anything else, we have to address hydration. We can't soften that stool if the body is still desperately trying to suck all the water out of it. This is absolutely the cornerstone of treatment, and we usually do it with fluids, either under the skin or through an IV, to get their hydration levels right back where they should be.
The treatment plan really has two parts. In the clinic, once your cat is rehydrated, our job is to give them that immediate relief. That often means gentle enemas to clear out the blockage. And I have to stress this one. Please never use a human enema product on your cat. They can be really toxic. This is a job for the professionals, for sure. Then we pivot to focus on the long-term management at home. That's usually a plan involving laxatives like lactulose, changes to their diet, and sometimes medications called Prokinetics, which actually help the colon muscles contract properly again.
And your role at home? Well, it's probably the most important part of preventing this from happening again. Switching to wet food is a total game changer for boosting their water intake. A water fountain can be great for enticing picky drinkers, and you want to follow the N+1 rule for litter boxes. That's 1 per cat plus 1 extra. It reduces stress and makes sure they always have a clean, safe spot to go. And just like with us, daily exercise from playtime is key, because physical activity actually helps stimulate the bowels and keep things moving right along.
So, when you put it all together, managing constipation is really about creating a lifestyle for your cat that supports good hydration, total comfort, and great digestive health for the long haul.
And that's really the key takeaway here. You are your cat's #1 advocate. By noticing those early signs and working with your vet on a consistent management plan, you can stop this from becoming a chronic, painful problem. You can make sure your best friend has a happy, comfortable life.
Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.